Today's presentation is going to focus on the Hispanic patient. We're going to talk about culturally competent nursing care for this patient and how to provide quality patient care. My name is Casey Ellis, and I'm a registered nurse, and today's date is April 26, 2015. As I mentioned, what we're actually going to do is we're going to explore cultural attributes and how to apply culturally sensitive nursing care to the Hispanic patient across the lifespan. So as you can see in the picture there, we're going to look at all age groups and genders. We're going to start with the childbearing woman and go all the way up to the elderly adult, and then talk about the community as a whole and how we as nurses can improve the care we provide these patients. What I want to do to start is actually just define the term Hispanic. So the term Hispanic refers to a diverse population of Latin America. So this is a widespread array of areas, and it includes those of Cuban, Mexican, Puerto Rican, South or Central American, or other Spanish origin, and it's regardless of race. So a wide array of people here that we're caring for. Hispanics actually are the largest minority group in the United States today, but they are the most underrepresented in the healthcare workforce. So what this means is, although we're having a lot of and seeing a lot of Hispanic patients, there's not a lot of Hispanic nurses, Hispanic physicians to account for all these patients. So even more important, why, if we are not of this culture, that we learn about it and in order to provide the best care possible. Hispanics comprise about 16% of the population in the United States today. By about 2050, though, they're going to make up over 30%. So by then, we're going to have about 1 in 3 patients as Hispanic. Hispanics often face significant obstacles to obtaining health care. So these can be financial, they can be income related. The biggest one is probably the language barrier. So it's very difficult for Hispanics who do not know much English or speak English as a second language to understand what a healthcare provider is telling them in English. And this is probably the biggest barrier that they face. Another barrier is insurance. A lot of them, unfortunately, do not have health insurance, which limits their doctor's visits and prevents them from getting preventative checkups and preventative wellness visits. So it's just important to keep these obstacles in mind as we're dealing with these patients. Hispanics view health holistically and focus on alternative therapies for treatment. So unlike Western medicine, although some of them kind of combine Western medicine and alternative medicine, Hispanics tend to focus on traditional ways of healing and herbal remedies, folk medicine, things in that arena in order to improve their health. Okay, they're less focused on medicine, more focused on traditional ways to improve their health, which we'll get into in a little bit. They tend to view everything in a group. They're very group oriented. They love family, they love friends, they love social networks, the community. They're not individualistic, so they're not selfish. They look at the whole group of people and really want to consult with their families, consult with their friends in regards to not just healthcare decisions, but any decisions. So as I mentioned earlier, we're going to start with talking about nursing care across the lifespan. So I want to start with the childbearing woman and their families first. And the role of the Hispanic woman is traditionally seen by providing a nurturing environment and maintaining the health of children in the family. So as a nurse, what we want to remember is maybe this Hispanic woman is so focused on taking care of her family and her kids. Is she taking care of herself? That's one thing to remember. We want to educate her on how to provide, what to look for with children and her family, and how to provide, healthy meals, in a healthy environment to live in and whatnot. The submissive role of the woman makes screening for domestic violence very important in this culture. Women are seen as submissive, to their partner, to their husband or partner, whoever it is. And it's just important that, as with any patient coming into a healthcare setting, that we assess for domestic violence and just screen for it. And you don't have to be direct. You can use it as just saying, hey, we do this for every patient that comes in. It's not directed specifically to you, but we want to make sure you feel safe where you live. So just another important thing to keep in mind, especially since it can be common among this culture. I want to talk a little bit about the pregnant patient. Some Hispanic patients feel like, especially pregnant ones, that they don't need to take pain medicine, or they don't want to take pain medicine, which is fine. That's completely up to them, but they feel that it may harm the baby, and it's not good for them as well. So what we want to do as a nurse here is be very culturally sensitive, respect their beliefs. Maybe we need to educate them on, hey, this pain medicine is safe for the baby to take. They still don't want to do it, that's fine, that's their choice. But always just looking for ways to provide non-pharmacological methods of pain relief too. So guided imagery, massage therapy, anything like that that's going to reduce their pain while being culturally sensitive to their needs. After birth, if someone is a maternity nurse, this is just something I want you to keep in mind. After birth, Hispanic family may want to take the umbilical cord or the placenta home, so don't act shocked if that's a request from them. Also, men typically are not in the delivery rooms for Hispanic births, so just something to keep in mind also. We're going to talk a little bit about disease and how the Hispanic view disease. Pregnant women actually consider pregnancy the hot stage of life. So Hispanics view disease as either hot or cold, and you want to treat it with the opposite one. So if pregnancy is considered a hot stage of life, it's going to be treated and with something cold. So you wouldn't give a pregnant person hot baths, for instance, because pregnancy is considered a hot stage of life. So just keep that in mind and be aware of, hey, what are the cold alternatives for treatment, what are the hot alternatives, and what popular diseases are considered hot, what are considered cold. And we'll talk more about that in a minute too. So now I want to talk a little bit about children ages 0 to 17 years old. So again, a wider range of ages here and developmental levels. Children are a big part of the family households for Hispanics. Actually, over 68% of families have children under the age of 18 living in the house. So just keep in mind as patients come in, they probably have a lot of brothers and sisters. Probably, there usually are a lot of children living in the house. Hispanic children have higher rates of asthma, lead poisoning, behavior and developmental disorders, and certain cancers. So what we want to actually look at here is about 90% of Hispanics live in metropolitan areas. So all this asthma can be coming from pollution, air quality, whatnot. So just important to educate the child, the teen or child if they're old enough, and family if they're not old enough to understand, on the importance of getting good quality air, avoiding pollution if you can, and then educating them about lead poisoning, behavior and developmental disorders, and then just for our own sake, being aware of certain symptoms of certain cancers that are more prevalent in this cultural group. Hispanic teenagers have actually a more individualistic attitude than their adult counterparts. So previously, in the previous slide, I was talking about how the Hispanic culture views everything as very group oriented. Well, this is a time that you want to not be stereotypical and just assume that teenagers have this view too. A lot of times they are more individualistic, so just keep that in mind as a nurse. So now I'm going to talk about the adult lifespan, and we're going to look at adults ages 18 to 64 here. Common medical problems for Hispanic adults include adjustment reactions. So this is their reaction coming to the new country, coming to the United States, how they react. Are they depressed? Are they lonely? Are they, struggling to make ends meet? Obesity is actually common among this group too. And with obesity comes type 2 diabetes often, and hypertension, and then also tuberculosis. We want to be on the lookout for. Nursing wise, it's important to know that these individuals, a lot of them have been vaccinated against TB, so we will see a lot of false positives in regards to TB tests. But anytime somebody of this origin is coming in with symptoms of TB, something as a nurse you want to be thinking about just to initiate those isolation precautions and whatnot. Approximately 43% of Mexican Americans over 20 years old are obese. So that's a lot. That's a little less than half. Now that's just Mexican Americans. Keep in mind that's not all inclusive of Hispanics, but this is a subculture of Hispanics. So it is a lot, and just educating these patients on how to maintain their weight, lose weight, eat healthy, exercise is important. Hispanics focus on alternative therapies and often turn to traditional healers to distinguish between hot and cold illnesses. So as I mentioned before, they're going to focus on what illnesses are hot and what are cold. And if an illness is hot, we're going to treat it with a cold treatment. If the illness is cold, we're going to treat it with a hot treatment. So just very important to know. For example, certain hot like diseases I mentioned were pregnancy, diabetes. They usually do not or do have visible symptoms, whereas the cold diseases do not have visible symptoms. So cold disease might include like menstrual cramps. You may not actually see that in a patient, but you want to treat it, something that's cold, you want to treat it with maybe something hot, so warm heating pad, etc., something like that. Herbal remedies are often used by this cultural group too at this age, so just as a nurse, you want to be aware of actually what the patient's taking, any reactions or adverse reactions that could affect them. Okay, I want to talk a little bit about older adults and the elderly, ages 65 and older. Physical health is actually the biggest concern for older Hispanic adults. So they're worried about their cells deteriorating physically. So just be aware of this. Educate them on, how they can prevent osteoporosis, how they can stay physically active. Educating them on how to exercise and just stay active is important. As we mentioned, elders are treated with great respect, but sometimes they experience emotional involvement while trying to keep the family together. So just understand that they may be, if you have one of these patients come in, they may be a little bit stressed if they're having any family turmoil going on, because they're the ones who are looked up to and kind of, expected to calm everyone down and make peace with the family. Preventative care is actually underutilized by Hispanic elderly due to distrust of healthcare providers, lack of transportation, lack of awareness of formal healthcare service, and lack of bilingual staff. So these 4 reasons are why Hispanic patients this age don't seek preventative care, which is kind of disheartening because distrust of healthcare providers. We want to be trusting and we want to help them. So just try to build that trust with patients of this culture and age. The older Hispanic individual may view change as threatening. They often actually exhibit higher levels of mental health problems than non-Hispanic whites, but they're less likely to seek care because fear of disrupting family dynamics. So encourage these patients that it's okay to seek care and that you want to help them if they're coming in with a mental health diagnosis, or give them at least the resources that they need. So just some general points on the community as the Hispanic community as a whole. Hispanics, as you've figured out through this presentation so far, Hispanics put a strong emphasis on relationships, interdependence upon one another is stressed over independence, and cooperation over competition. So they're really group-oriented, like I mentioned before. They value and respect the advice of healthcare providers. So in general, they do. Like I said in the previous slide, older adults may have a little more distrust, but trust that they are going to respect what you say and be confident to educate them and teach them on what they need to know. They have a lot of positive indicators, but actually as they tend to move to the United States, surprisingly, these positive indicators decline. They participate in a more sedentary lifestyle, become obese, etc. So just educate them, on avoiding processed foods. They're not probably used to eating. When they come over here, they have, a lot more sedentary lifestyle, a lot more unhealthy food choices that are staring them down. So just educate them on how to maintain their positive indicators and keep a healthy life. And then we just want to encourage them to continue their positive lifestyle choices, like I said. 68 of Hispanics living in the United States are actually Catholic, so just keep in mind if they're coming into the hospital and they want to have communion or want to have a priest with them to pray, be aware of their religion and culturally sensitive needs in that regard. And like I said, they are very active in their community, so targeted public health campaigns are really effective ways to reach the Hispanic community. So if you wanted to do a project or educate anyone on in this culture, that's a good way to do it. So as the Hispanic population continues to grow at this rapid rate, it's really essential that healthcare providers are knowledgeable of and respect the values and beliefs that this culture holds, okay? Nurses that demonstrate cultural competency across the lifespan will be able to provide better quality care to patients of Hispanic origin. And then here are several resources that were used in the making of the video.